So this ASCO is very exciting for a simple reason that we are actually presenting fairly mature data on monoclonal antibodies. We in the myeloma world have been waiting for monoclonal antibodies for a long time. It's ironic that myeloma is an antibody producing cancer and yet did not have an antibody directed against it. But we now have two, and those are going to be presented tomorrow in the oral session at ASCO. One of them being the ELOQUENT trial, which is elotuzumab with lenalidomide and dexamethasone. This is being presented tomorrow, the phase 3 experience of 600 and close to 650 patients, where they've shown an increase in response rate when you add the antibody to Len-Dex, and this is translated into a very nice progression-free survival benefit of about 5 months, and importantly a risk reduction of progression by about 30% in this patient population. So elotuzumab seems to be generally well tolerated. There's another poster in combination with bortezomib as well. So elotuzumab in combination with bortezomib. This is a phase 2 trial, but again showing a significant response rate and efficacy as well as tolerability. So the neat thing about monoclonal antibodies is because of the nature and because of the fact that they're not cross-resistant, you can actually combine them with anything. You can combine them with an IMiD, you can combine them certainly with proteasome inhibitor as well. I think most excitingly though, there's data going to be presented on a single agent monoclonal antibody, and this is data being presented on daratumumab, and this is again a phase 2 trial with daratumumab, where daratumumab is being used in quadruple refractory patients. We do have that patient population now, believe it or not, in myeloma, where they've seen lenalidomide, they've seen bortezomib, they've seen carfilzomib, and they've seen pomalidomide, and we need something there. And what's striking in this very heavily pretreated patient population, which is refractory to a lot of all of these agents, is the fact that we're seeing a 30% response rate in this patient. And more importantly, actually, in this refractory patient population where we never thought about seeing complete responses, we are seeing a percentage of patients who actually get to that complete remission.